You are watching the Doctalk show.
Excessive bleeding in pregnancy is the leading cause of death. It's a contributing factor to Uganda's very high maternal mortality rate. So I want to know if there are ways a doctor or a nurse or an attendant can recognize that a pregnant lady who has just delivered a baby is having excessive bleeding. So Dr. Masiko, there are some what I would call early warning signs before the situation goes out of hand. Some early warning signs someone can recognize to know that this lady is bleeding too much.
One thing about them is that many times they arise unexpectedly. Much as we've seen that there are particular risk factors which we can look out for, but people out there should not think it's only people with those risk factors that we've mentioned that are at risk of obstetric hemorrhage. In fact, pregnancy complications like 15% will occur without any prior risk. So it is very important.
So that means even if a mother has no those risk factors we talked about, it can still occur.
It can still occur. So even before we look at these early signs, in case the risk factors are there, someone should make adequate preparations because they are already anticipating a problem. But then how would you know the early warning signs? This one really depends on who. Because, for example, mothers who have given birth before, they may have an idea of what the normal bleeding after birth is. So they can easily know that now I'm bleeding much more than usual, and they can alert the health worker. But generally, what would alert a mother is if they are bleeding more than expected. For example, if we told her that your pad probably may get full in over 2 hours and you find it is getting full in just a couple of minutes and she's seeing bleeding with clots, that may be the early warning. But unfortunately, some mothers can deliver and lie in bed without even noticing they are bleeding. So one important thing is a mother who has delivered should always have someone by her side to keep checking on her. It might be the attendant, but then it is also very important for health workers. When we are training health workers, we emphasize this post-delivery monitoring because you can never know when it will happen. In fact, the standards are, for example, that in the first hour, a mother should be checked on every 15 minutes in the first 1 hour. Then in the subsequent 2 hours, the health worker should be checking on the mother every 30 minutes. And maybe if in those first 2 hours she's a bit stable, then they can check on her every hour. So post-delivery monitoring should be the thing.
But does it occur in our congested hospitals, which have very few doctors? What are the standards like now?
That is where the problem lies. The standards remain standards even when you can't achieve them, and it is really difficult in places where there is this congestion. But then other warning signs to the mother, of course, like anyone who is bleeding, the mother may start getting that lightheadedness. She feels weak. She feels dizzy, like she gets maybe cold extremities. She becomes pale. And in fact, they get all those before they may suddenly collapse if they have bled a lot and they are going into shock. Yeah, but there are those early signs of weakness which come in as they are becoming anemic. But for health worker, if you're monitoring, then you will know because you will see the blood pressures changing, becoming lower. Yeah? You know, there are those.
And then the health worker starts the appropriate treatment. Are there any other complications apart from the most feared dying from the problem? If someone survives, could there be any other complications that come because of the bleeding? Dr. Seveliva?
Yes, thank you, Dr. Darius. Well, when a mother dies, remember, most of the mothers would leave an infant or a neonate, a young baby. Some of these complications occur to the baby because when a dead mother means the baby won't breastfeed. Now, usually these babies suffer from the complications of non-breastfeeding. They would have, they will be at risk of getting infections. They will be at risk of not thriving or not growing well. And this may affect their future development.
Okay.
Also, death in itself would lead to a society problem. This is a mother who was taking care of many other relatives. They had maybe a business they are running. Some of them have dependents. So when she's away, the society or the people that she was looking after would also be suffering.
Her dependents
dependents.
End up suffering because of the loss.
Yes.
How can we protect mothers from bleeding too much? Are there any ways, any prevention ways someone can undertake? Maybe Dr. Masiko.
Yeah, thank you. Like we said, many obstetric complications really occur suddenly, and yet they progress rapidly. Like obstetric hemorrhage, it can kill a mother in a few hours. That's like 2 hours. Someone may get a cervical tear, and in a few hours, they are gone because it is very torrential bleeding. So prevention is really important. And like we've said, it's very important that these mothers attend antenatal care. What is done during antenatal care in line of hemorrhage basically is to identify those risk factors we talked about. When a mother goes for their first visit, during that process of taking history, all these things are asked about. So you're able to identify which mother is at risk, and you know she deserves special attention. So you advise her where to deliver from, and even when she comes for delivery, the risk is already known. So steps are taken to make sure she doesn't bleed excessively. And also during antenatal care, we have supplementation because we give mothers like iron supplements, which help to build their blood volumes. You know one thing, Darius, some mothers, like Dr. Sebeliva said in those definitions, like you lose 1 liter or 500 mils. But there are mothers who may come to deliver when they are already anemic, even when they lose very little blood, are so low.
So
Any blood loss to them, yeah, even when they lose the normal volume, they are at risk of complications. So during antenatal, mothers are given these iron supplements to build their blood volumes. Even their blood levels are assessed, the hemoglobin levels, so that you know who needs more supplementation, such that by the time they deliver, at least they have adequate blood levels, because every mother is at risk generally.
So antenatal, taking the iron tablets to increase the blood volumes, and regular checkups with the gynecologist. So these are some of the prevention ways, and we shall come back shortly after the break to discuss more about prevention. But the take home, one of the important key messages is excessive bleeding kills, and often it kills very fast, much faster than probably an infection. Within a matter of minutes or hours, a mother might end up losing her life because of excessive bleeding. So it's quite a big issue to recognize and to manage aggressively and very fast in order to save a life. So don't go away after the break. We shall be back on more about prevention of excessive bleeding.
You are watching the Doctalk Show. In our future story today,
This is where pregnant mothers who need emergency sections are operated upon. This is where all mothers are received, those who come in labor. Some are booked with us and some are referred. All of them are received in this labor ward. At the triage area, there are midwives and nurses who assess the mothers first to know those who need urgent attention. So we receive about 100 mothers per day. This labor ward does about 80 deliveries in 24 hours. So the ward has sections. It has a number of cubicles. You will see the cubicles where mothers in labor are put. There are other cubicles which have mothers with complications. There are those who have come with high blood pressures, those who have come with intrauterine fetal death. So this is the admission room where we have the frontline doctors, usually interns or call them junior house officers, assisted by the medical officers. So all the mothers must first be examined in this place before they are admitted to the different cubicles of labor ward. So this is one of the delivery rooms in labor ward. You see it has about 8 to 10 beds, a delivery room. The mothers you're seeing here are those that have just delivered. So immediately after delivery, they rest here for some time as they are being observed. Then afterwards, they can be taken to the postnatal ward. This is the ward where mothers who come with very high blood pressures and related complications are usually first admitted. Complications related to high blood pressure are the second biggest killer of women. They are monitored here, they are stabilized here, and their plans are made for them to be delivered. This pressure is induced by the pregnancy itself. So it is a pregnancy-induced high blood pressure. So the biggest risk factor is being pregnant. We don't have a particular assigned cause, but we know risk factors, like someone carrying their first pregnancy is more at risk of getting this condition. Someone also has carried many pregnancies, like above 5, or if they are all getting old, like above 35 years, you find they are at an increased risk. There are those people who are already known hypertensives, like they already have high blood pressure, even before they conceive. So you'll find they are also at an increased risk. But generally, they may make not more than 5% of all the mothers we have. That's why every pregnant mother who comes for antenatal care, one of the most important things that should be done during antenatal is to check her blood pressure. One of the things that the labor ward is congested. Mothers are very many, but that one we understand because currently the referral system is not well streamlined. This hospital ideally should receive only mothers that are referred who have complications. But because we don't stop anyone who walks in, most of the ones you're seeing have referred themselves. So we run out of what to use. You find theater instruments are finished, yet there are many other mothers who are waiting to be worked on, and that one leads to their poor outcomes sometimes. Then the referral process is poor. Mothers reach here when they are already compromised. Some of them are referred very late. Like you've seen some of the challenges, people come here, deliver babies and abandon them. That shows you that probably these were unwanted or unintended pregnancies. So people should start embracing modern contraception because it is available, so that they don't get unwanted pregnancies. Then when they are pregnant, they should start attending antenatal care early on time, so that if they have complications, they can be detected and treated on time.
We find that we've discharged mothers, but you find that there are babies who don't have mothers. So we pick them from the postnatal ward usually, mostly. So we just pick that baby, we bring it here. Then there are those whereby the mother died and she was taken to Chirudu, but no one turned up to check on that baby. So we remained that one also, joined among the abandoned. Then another one, we had her here on our incubators. It was cared like some days. Then after the baby was left in an incubator, we keep them in our sitting area where we sit. We make sure that these babies are cared for. This is the milk we give. We have our milk. We have our bucket with the bottles. We have a kettle. We boil water and we feed these babies to make sure that life goes on and we see that they are really well with us.
You are watching the Doctalk Show.